Welcome you all at Indian Institute of Learning Life Saving Skills. Today I'll welcome you all in continuation with clinical case scenario discussion, and today's topic of discussion is giddiness, vertigo, dizziness. Giddiness, vertigo, dizziness. These all three are interchangeable words. Patient presented with complaint of giddiness, dizziness, vertigo. So all three complaints, they overlap with each other in with their representative sign and symptoms. So when patient arrives with complaints of giddiness, with persisting vomiting, sometimes not able to stand and walk, sometimes not able to even stand, not able to even walk, so this may be most crucial important sign of neurological manifestation that we call as stroke. CVA, cerebrovascular accident, stroke. Sometimes these patients presented with vertigo, giddiness and dizziness, and they are not able to walk straight, they are not able to even stand, and when you examine them in a supine position, they are able to lift their hands, they are able to lift and fold their limbs, and they will complain of giddiness. So when you check them or when you examine the muscle power with respect when they are in the supine position, you will find that muscle power will be 5 by 5. When you examine them when they are in the supine position, you will find they are able to lift their legs, able to lift their limbs, able to respond, and the muscle power will be 5 by 5. But if you ask them to stand up, they are not in a position to stand properly, they are not able to bear the complete weight of their body, and they tends to sway on either side, either left or right, and there will be severe giddiness on slight movement of their neck, and these are the strong manifestation of a neurological symptoms. See, giddiness can be presented with n number of clinical manifestations. Example: accelerated hypertension, systemic hypertension, malignant hypertension. Any kind of auricular manifestations, problem related to ear manifestation, any kind of otitis media, they presented with giddiness. Then persisting diabetic dyslipidemia, they presented with vertigo. Cervical spondylosis, most common presentation, they presented with the vomiting, they present with the giddiness, and they are not able to stand. Sometimes we consider these patients as likely that they are giddiness means they are because of cervical. Then this because of dyslipidemia, this because of morbid obesity, this because of some kind of orthopedic neuromuscular component complaints. But if the patient is not able to stand properly, not able to walk properly, then we must rule out the neurological manifestation, and the more deadly emergency is considered to be cerebrovascular accident, stroke that we called stroke, hemiplegia. Sometimes stroke patient may not present always to be unicided hemiparesis, hemiparesthesia, hemiplegia, or either monoparesis. Sometimes they presented with paraparesis, bilateral lower limb weakness. That also a presentation of a stroke. For new learner, those who are new to the emergency department and those who wish to learn the cases of emergency medicine, sitting in a triage, the patient comes with complaint of they are not able to walk, they are not able to stand properly, or they have severe giddiness. That has to be ruled out by doing the non-contrast CT scan or by doing the MRI brain. These giddiness, because you must give the importance to the neurons of the brain. Because if it is cervical spondylosis, nothing to worry. You can delay the treatment, you can stabilize the patient, or you can delay, or you can postpone some kind of investigations. But if you are suspecting strong neurological manifestation, strong neurological etiology, then you must ask the patient to undergo at least non-contrast CT scan, or If the patient is in window period, the patient, if the MRI facility is available, that can go undergo MRI with diffusion weighted imaging, so that we can find out the infarct. So sometimes the posterior circulation infarcts, cerebellum infarcts, they presented with the complaints of giddiness. And if we are failed to understand this is because of neurological manifestation, the treatment will be delayed and there will be more damage to the neurons, and our treatment will be delayed, because we will able to do the scans in the successive presentation or successive consultations, either after 3 days, 5 days, or after 10 days. By the time there will be irreversible damage to the neurons of the brain. So when patient comes with complaint of giddiness, we must consider even the neurological manifestations along with the cervical, along with the ear manifestation, along with the dyslipidemia, along with the diabetics or some other metabolic disorders. So patients of giddiness, we must consider the neurological cause just to rule out and to make the diagnosis over properly. Exact diagnosis or even suspicious of and anything which is going to happen impending is the work job of a person who is sitting in emergency or in a triage or in a casualty. What is going to happen? That kind of suspicious should come when we are sitting in emergency while evaluating the patients. The earliest non-contrast CT scan may come the normal in early if it is done within 4 hours of window period. But if you repeat the MRI, or if you do the MRI with diffusion weighted imaging, or after few hours, then you will able to find out the acute infarct in the patient with manifestation. So we must consider the neurological cause as and when the patient presented in emergency with vertigo, dizziness and giddiness. Not only to consider till the cervical spondylitis or ear manifestation, just we must wide open our area beyond the including the neurological manifestation. So thank you very much for watching this. Be connected with us to learn the most important things in emergency when you are sitting, not to miss the diagnosis. See, everybody will diagnose after some point, or patient able to diagnose even after some point when they are referred somewhere and also. It's all about suspecting or diagnosis as soon as possible the patient arrives, rather than the delaying the diagnosis. So it is always important your judicious clinical examinations, history taking and collaborating all together with your intelligent investigations. Only we can able to diagnose the things properly and for the best interest of the patient. So thank you very much for watching this. Be in touch with Indian Institute Learning Life Saving Skills, and be the savior and be the thank you.